Hello everyone, this is Team NSO. We are going to do presentation on splints for femur fracture. What is a splint? A splint is the most commonly refers to splinting device that uses straps attaching over the pelvis or hip as an anchor, a metal rods to mimic normal bone stability and limbs length, and a mechanical device to apply tractions to the limb. Device classification. The classification of our device belongs to class 1 type. Predicate: casting open reduction and internal fixation. This involves a surgery to repair the fracture frequently and some equivalent device which come under class 2.
Now coming to Oxford creativity. First, functions. Under function, there are two, that's sponges and brushes. Next, parameters. Under parameters, knob and composite materials. Then transform. Under transform, adhesive and porous material.
Coming on to performance requirements, functional requirements lay the patient supine with injured lower extremity supported. Safety requirements should not cause any kind of infection to the patient. Usability requirements, efficiency of use, that is, the goals are easy to accomplish quickly with no errors. User interface to meet physical and behavioral need of the patients. Clinical workflow stabilize the injured leg. Internal interface internal splints must be placed underneath the nasal bones so that the bone fragments are sandwiched between the external and internal splint. Working environment should be efficient in all temperature. Infrastructure. The device infrastructure should be designed in such a way that user can understand it. Safety. The device should be user friendly and the device should not cause any type of pathological or chemical harm to the user.
Coming to adaptability, the device should be able to operate in various of conditions and the splint attached should be risk-free to patient. And availability, the device should be available at all diagnostic centers and clinical hospitals. Labeling, the labeling should contain all the information about the function and operation of the splint. Operation operating cost. It should be cost efficient and it should be affordable to the end user. And disposal. Some sprints are constructed of heavy duty and with half density plus cushioning form. User training. Femoral traction sprints are designed to apply traction to lower portion of the leg distal to fracture usually by pulling the ankle away from the stabilized pelvis. Coming to clinical workflow, and before the product use, the first thing that need to be done when making splint is something rigid to stabilize the fracture. Items that can be used are a rolled up newspaper, never a heavy stick, bond or plank, and rolled up towel. Avoid using commercial tape such as duct tape directly against a person's skin. Then coming to action during product use, that attend to any bleeding, apply padding, place the splint, watch for signs of decreased blood circulation or shock.
Duration of use. The splint is intended for provisional stabilization and can be used up to 2 to 3 weeks. In the rare case of definitive non-operative treatment, it can be converted for a long leg cast of 1 to 2 weeks. Other products start-stop. The Scordia Thomas splint can be used to immobilize any fracture distal to midferrum or mid-humerus. Things to avoid impacting. Femoral transection splints are used to temporarily stabilize and possibly reduce femoral shaft fractures. The contradictions are pelvic fracture, isolaterial functions, and isolaterial knee injury. Critical clinical processes. A clinical process is a set of interrelated or interacting healthcare activities which are performed for a subject of care with one or more health issues. The primary input and output of the clinical process is the health state. Femoral transaction splints are used to temporarily stabilize and possibly reduce femoral shaft fractures. Thank you.